Hello, lovelies. Welcome back to my channel. For those that are joining us for the first time, my name is Mboi. I work and live in United Kingdom. So, when I first came here, I had to learn way of life, cultural differences, language, accents, and I went onto the internet. I read a lot, and I came to realize that life expectancy in United Kingdom is way beyond the one that I'm used to back home. And here in UK it's way more than that, and I've witnessed it. People can live beyond 100 years, and well, looking at how things are, poverty levels, level of fitness, like people take care of themselves here. Even the government, it is supporting its people. So life expectancy is actually very high. So people get to grow old and they need to be cared for because they are now losing the abilities that they used to have when they are young. This is what we are going to talk about today because I think I came here to work in a care home as a nurse. I'm caring for vulnerable individuals, adults who are above 60 years old and are living with dementia and Parkinson's disease, or they don't have those diagnoses but they are old and they can no longer take care of themselves at home. Looking at the life expectancy, like I've been saying, UK have a lot of people, like a larger population of the United Kingdom British people. They are old and they need to be cared for, and they are cared for in the care homes. The care homes are sort of like you take someone out of their home, you keep them in one place, and you have professionals like nurses, senior carers, kitchen staff that will be cooking, the chef, cleaners, so that you continue their way of life, but then you support them in a care home. So most of the times, those that do not have capacity to do things by themselves, they are cared for in a care home. But those that are still able to do some of other activities of daily living, they are still cared for in their own home, which is called domiciliary care or support work care, like support care in their own home. And so a lot of people, or there were lots of vacancies that were advertised, and it was very hard for employers to fill the positions. So the government sought into skilled workers visa, whereby people were now allowed to apply from abroad and come work in the healthcare sector, whereby you are now going to be working in a care home. And in terms of the visas, are well stipulated in the government website. A lot of people applied, nurses from abroad, a lot of nurses from India, from Nigeria, from Philippines, all over the world, including African countries, Lesotho, South Africa, Egypt, Ghana, Kenya, Namibia, Zambia. There are so many individuals that applied for skilled workers visa to come and fill positions in the health sector, to care for older age people, and even work in the NHS, which is the government entity. Now, looking at the numbers that were published by the NMC, there are lots and lots of nurses that are from abroad, and the government is trying to recruit to put in place to train nurses from locally. And to reach that, it's going to take time. And we know that by March 2024, the government put in place new immigration laws trying to cap the net migration that was evidenced that it was just too high. So the numbers have fallen a lot in the first quarter of this year, and about 80% of applications were, like, compared from last year at the same time, 80% difference was noted, meaning there are less people now who are applying. And this is putting pressure on the care sector. So there is an article that was published by the BBC on the 21st of August 2024, and it's going to show how the changes put in place by the government to try and keep the net migration down, it is impacting the care sector. So this is the article. So this is BBC News webpage, and this article was published on the 21st of August 2024. The title says, Claim Immigration Limits Could Shut Care Homes. So this article was written by Liam Evans. More care homes in Wales could close due to changes to the UK government's immigration rules, a body representing homes has said. Care Forums Wales CFW is concerned about a tightening of immigration rules in March that made it more difficult for people who move to the UK to work in care sector to bring their family members with them. One care home said a lack of local interest in the care sector jobs meant it had to rely on foreign workers. The United Kingdom government said it was committed to reduce historically high immigration levels with the aim of training more workers in Britain. The number of people applying for the UK visa to work in the care sector fell by 80% in the first quarter of 2024, the latest official figures indicate. Since March, most people moving to Britain to work in the care sector can no longer bring their family members with them, as the government aims to reduce immigration numbers. Statistics show that the number of people applying for the UK visa to work in the care sector fell by 80% in the first quarter of the year 2024. Catrev Brainier Care Home in the Pentrafalls, Conwy County, said it was dependent on overseas staff. Carers from the 10 different countries look after the home's 30 residents. We have been trying to recruit locally for years, but no one applies for the jobs, said the manager, Mayrel Wellesby. No one wants to work weekends, nights, and it's not attractive. She said the new restrictions for foreign care workers and family members made staffing the home even more challenging. It's easy for the government to say, oh well, you can't recruit from abroad to bring our numbers down. But the thing is, where are we going to recruit from? There's no one else and nothing else we can do. Care Forum Wales said it feared the changes to the rules could lead to major problems. It's going to be a big concern in the coming years, said Kim Ombla, a care home owner on the Anglesey and spokesperson for the Care Forum Wales. If we can't get workers from abroad and also can't get local workers to fill the gap, there is a big worry that homes could close because of this. There are also difficulties with the processes around sponsoring care workers to come to work in UK, she added. The Labour UK government said it had a clear plan to reduce high numbers of illegal immigration. By combining immigration, the labour market and skill system, we ensure that the workforce can be grown in the UK, it added. A Welsh government spokesperson said that recruiting and retaining staff in social care remains a significant challenge. It expressed concerns about the previous Conservative government's announcements to limit dependents coming to Britain. However, it said that there isn't enough data yet to show solid evidence of the trend and welcomed the UK government's commitment to better engage with devolved administration. So this is the article that was published by BBC. One can only think You can only ask yourself how the country is going to survive if the care homes are to be closed. There are so many people who need to be cared for in the care homes. There are many, trust me. Where I work, we hardly have an empty bed, and almost every month or almost every 2 weeks, we get a call from social services asking whether we have a vacant bed. And if the migration rate goes down to zero, and looking at the time frame where you're going to be training local people who are already in the UK to join the care sector, it's going to be disastrous. What is the plan from the government? What are they going to do? Because those people who are old, they really need care. They need to be cared for. But looking at the article, the employer said they advertise, but the employment vacancies are not able to be filled in the country. That's why they sought to employ from abroad. There is still a lot of openings for carers, for senior carers, that are advertised on Indeed, on the care home websites. There is just a lot, but it looks like people who are already in the UK are not applying into joining the care sector. What is going to happen with the vulnerable individuals that need to be cared for in the care home? So, for those that are still outside the United Kingdom and you're still looking into joining the country, there is no new updates that says people are no longer allowed to apply. The NMC is still open for international applications. If you go on their website, it's still there. And even the skilled workers visa is still there on the government website. But there are rules that need to be followed. Meaning, if you apply as a senior carer, just know that you're not allowed to bring your family. If you apply as a carer, just know that you're no longer allowed to bring your family along with you. But if you apply as a nurse, a doctor, pharmacist, or other skilled workers, you are still allowed to bring your family members with you, but you are going to pay a lot of cash to support your application. I wanted to show you that the care homes are now crying out that they are going to close because there is no human resource. When they advertise, people are not applying, but they still get volumes and volumes of applications from abroad. Okay, thank you very much for watching this video thus far. I'll see you in the next upload. Bye.